from the Lakeside Newsroom of the Henrico Citizen, your hometown news source since 2001. This is the Henrico News Minute with publisher Tom Lapis.
Henrico County is planning a $14 million detox and recovery center, and we've got details about how many Henrico students will be returning to school in person when that day comes. On today's Henrico News Minute, it's Thursday, November 19th, 2020. Today's News Minute is brought to you by Commonwealth Catholic Charities and Henrico Area Mental Health.
And now for the news.
When in-person learning eventually resumes in Henrico County's public schools, only about 36% of the school system's 49,408 students intend to show up. The rest will continue learning virtually. That's according to results of student intent surveys that were completed earlier this month by Henrico families and provided to the Citizen Wednesday at our request. With the decisions of about 2,700 students still unaccounted for, the data showed that about 41.5% of elementary school students, 36% of middle school students, and just about 29% of high school students were planning to return. Those numbers generally were higher among West End schools and lowest among Eastern Henrico schools, though there were a few notable exceptions. Of course, plans for in-person learning to resume later this month at the elementary school level have now been delayed until at least January 11th as the result of rising COVID-19 cases in the county. The survey results showed that the desire to return in person was most evident in one specific elementary to middle to high school feeder pattern in the near West End. At 82%, Tuckahoe Elementary was the only Henrico school with an in-person return rate above 58%, and there was only one middle school, Tuckahoe Middle, at 58%, with an in-person return rate above 47%. The only high school with a rate above 32% was Freeman High at 47%. Tuckahoe Elementary and Middle both feed to Freeman High School. Some Tuckahoe Middle students also attend Tucker High School. Overall, there were 11 elementary schools with in-person return rates of 50 to 58%. At 12 others, however, fewer than one-third of students are planning to be back in person. The in-person return rates at all but 3 middle schools, Tuckahoe, Pocahontas, and Hungry Creek, were between just 21% and 38%, and the return rates at the 8 other high schools ranged from just 17% at Highland Springs to 32% at Godwin, although some 600 students at Highland Springs had not yet responded as of November 13th. Henrico Schools employees also were completing their own intent surveys while parents did the same. Their choices amounted to returning to work in person, requesting accommodations to continue working virtually, requesting some form of leave time, or resigning or retiring. And though the exact results of the staff survey are not clear, Henrico School spokesman Andy Jenks told the Citizen yesterday that since August, a total of 508 employees had requested accommodations, 301 of which had been granted as of Friday, while 22 others had requested discretionary leave, 76 had resigned, and 16 had retired. The school system employs more than 7,100 people in total. The student in-person return rates seem generally to reflect the racial composition of individual schools in a large number of instances, though not every single one. Generally, schools with higher percentages of white students were more likely to have higher in-person return rates, while those with the highest populations of Asian and black students were most likely to have the lowest such rates. You can read my complete recap of this data at henricocitizen.com by clicking on Education. Henrico police this year have already responded to more than 41% more overdoses than during all of last year, according to county data. And with that in mind, Henrico County Manager John Vitolkas is making what he has termed a bold proposal to address the issue of substance abuse. In an article that we ran exclusively yesterday on henricocitizen.com, Vitolkas is proposing the county-funded creation and construction of a $14 million detox and recovery center in eastern Henrico that would be managed by Henrico Area Mental Health and Developmental Services, but ultimately operated in partnership with one or more non-governmental entities. Henrico officials late last month posted a request for proposal to solicit bids for consulting services for the project, which are due by December 1st. pending approval from the Board of Supervisors, they intend to allocate about $3 million during the current fiscal year to begin the planning and design process for the building, then fund the remaining $11 million in the coming fiscal year budget, which begins July 1st. The center would be located near the county's new Mental Health East facility and the Eastern Henrico Government Center on 9 Mile Road, and it would be designed as a 24-hour inpatient, medically supervised detox and recovery center with an initial capacity of 12 to 16 beds, according to the RFP. Vitulcas and county officials envision the facility as a touch point through which those dealing with immediate needs can get the help they seek, regardless of which form that might take. There's only one other Virginia locality, that's Fairfax County, that has something similar. Vitulcas anticipates that it will take about 2 years from start to finish to plan, design, build, staff, and open the facility once the county has signed a contract with a consultant in January or February. The idea for a county-owned recovery center came from the work of Henrico's Recovery Roundtable, a task force composed of various public and private officials from a variety of related fields that formed about 18 months ago and met about 9 times. That task force offered 8 final recommendations in a 196-page report it issued in February. One of them was the creation of such a short-term facility. The chief medical examiner of Virginia has reported 36 drug overdose deaths in Henrico so far this year during the first 6 months of the year. That's 7 more than during the same time frame last year, which ended with 74 such deaths. And Henrico police have responded to more than 410 overdoses, already more than they did in 2017, 18, and about 120 more than last year. Opioids continue to be responsible for more fatal incidents in Henrico than any other drug, but alcohol and cocaine are creating significant issues in the county as well, according to Henrico Area Mental Health Clinical and Prevention Division Manager Daniel Rigsby. He told the Citizen that of those who come to the county for help, about an equal number have abuse issues with opioids as with alcohol. Cocaine and marijuana disorders register at the next rung down on the list. Rigsby said that even though overdoses have gone up since the beginning of the pandemic, the requests for services received by his department have not. Some of those in need likely are connecting with private recovery groups, he said, but others may not be. The nature of substance abuse disorders is that a desire for recovery can be fleeting, according to Rigsby. That's why he and other county officials believe it's important to have immediate help available for those who seek it. The new county facility would treat people regardless of their insurance situation, which is one major roadblock for many who are seeking detox services, which can range between $2,000 and $5,000, according to Rigsby. You can read much more about this planned facility on HenricoCitizen.com right now by clicking on Government. One more Henrico Elementary School has reported a COVID-19 case. Greenwood Elementary in Glen Allen reported the case Tuesday. It occurred in a person who was last in the building November 11th. That is the 74th case in a Henrico school since August 12th. In total, 43 schools have now experienced at least one case of the virus.
Every 12 minutes, a Virginian dies from an opioid overdose.
Every 12 minutes.
Opioid overdoses are on the increase in Henrico. Yes, the opioid epidemic is still impacting residents in Henrico.
But you can help.
To find out what you can do, go to bouncebackHC.com.
That's bouncebackHC.com. Knowledge is power, including learning about naloxone. That's naloxone, which can temporarily reverse the toxic effects of an opioid or heroin overdose.
Get informed, get help, save a life.
Go to bouncebackHC.com. That's bouncebackHC.com.
To equip yourself with the knowledge to help our residents and the community of Henrico County against the opioid epidemic.
Knowing what to do will allow you to be prepared to save a life. Go to bouncebackHC.com today.
That's bouncebackHC.com or call 804-727-8515.
That's 804-727-8515. Directly for substance abuse services.
This message is sponsored by Henrico Area CSB Prevention Services.
Virginia Governor Ralph Northam expects COVID-19 vaccine distribution in the state to begin in about a month, he said during a press briefing yesterday. Initial limited quantities of the vaccine are expected to be prioritized for healthcare and medical officials and senior citizens. Virginia Health Commissioner Norman Oliver said the state already has identified 14 cold storage locations at which it plans to store the Pfizer vaccine at the low temperatures required. Northam also recently allocated $22 million in CARES Act funding to help build the infrastructure to distribute the vaccine, but he said the state still needs additional funding to do so. During yesterday's press conference, Northam urged Virginians to be responsible during the coming holidays. Northam recently announced new restrictions in Virginia that include limiting the number of gatherings to 25 people and lowering the minimum age to 5 for a statewide order that requires masks to be worn indoors. Henrico County yesterday set a new all-time high for the most new COVID-19 cases reported on a single day with 95. That eclipsed the previous daily high of 81 set July 27th and matched 3 days ago. 3 new hospitalizations related to the virus in Henrico also were reported yesterday. The county's average number of new daily cases in the past week also set a new high of 59, eclipsing the previous high of 55, which was set earlier this month. Henrico has experienced a total of almost 260 new cases in the past 3 days alone. That's by far the most during any 3-day period since the pandemic began. Now, the higher COVID numbers appear to be reflective in part of an increase in testing in the county. Testing has increased dramatically recently, reaching a 7-day average of more than 1,200 per day as of November 14th, up from just about 900 a day 5 days earlier. Henrico's 7-day positivity percentage actually decreased to 5.4% as of November 14th, but that reflected a lower number of cases reported late last week. The metric lags several days behind by design in order to allow time for all tests and results to be included and to present the most accurate snapshot look at any given week in time. The figure is expected to climb as this week's data is added in the coming days. Today's Henrico News Minute has been brought to you by Commonwealth Catholic Charities. Change the world for a teen who needs you. Become a foster parent. Learn about Commonwealth Catholic Charities' International Foster Care Program today. Call 804-545-5949 or visit cccofva.org to learn more.